The American Medical Association says the U.S. faces a growing shortage of physicians, especially those in primary care fields like internal medicine, mental health, and pediatrics. By 2034, the group predicts a shortfall as much as 48,000 primary care doctors, driven by population and demographic trends and burnout. Fred de Sam Lazaro found one doctor-patient model that may benefit both, one piece of the patient revolution. The story is part of his series, Agents for Change.
Deep in Wisconsin's Northwoods, Kristen Dahl-Winther is living her dream. From the pancake breakfast,
I am not the cook of the house,
to seeing her kids off to school, Dahl-Winther savors these moments before heading to work at Birchwood Family Medicine, a clinic she started 2 years ago.
I grew up watching Dr. Quinn, Medicine Woman, and idolized her, and I ended up forming a relationship with Patch Adams, the doctor, not Robin Williams, of course, who played him in the movie, but really just got inspired around how he delivers care in a way that really doesn't take cost too much into consideration.
Her first stop after med school was the Mayo Clinic, where she spent 10 years. Financially rewarding, she says, but at great personal cost.
It was beaten into you in training that you just need to work constantly. I would work from 6 a.m. till midnight, and I'd put my babies to bed and they'd say, "How many charts do you have left tonight, Mommy?" It's what we've always wanted to do.
Now she has time for both family and patients.
When I was at Mayo, I certainly knew my patients, but I had 3,000 patients that said, "She's my primary care doctor." And here, our practice closes at 600. I have 5 times as much time with every patient. Oh, sure.
It has had a cost, this time financial, a 60% pay cut, one she hopes to recover as the clinic grows to the 600 patient cap she's set. It's now at just under 400.
You changed your hair.
Adult patients pay $80 a month for what's called a membership. It buys unlimited clinic visits, 24/7 access to Dahl-Winther, typically using a secure app, and significantly discounted imaging and lab tests done right in the clinic, like a comprehensive metabolic panel or CMP, a blood test to check a patient's metabolism and chemical balance.
The difference is astounding. CMP, a metabolic panel, at Mayo, they're going to bill $134 around there for a CMP. Here it's $4.50. And that's true across the board for every lab, every X-ray or radiology exam.
The Birchwood Clinic operates on a model that's become known as direct primary care, practices that avoid dealing with insurance companies if at all possible. Across the United States, some 2,000 primary care clinics now operate on some variation of this model.
Let me just check your others.
For patients like 25-year-old Russell Bacon, it's the difference between having and not having health care. His job as a heavy machinery operator doesn't offer health insurance.
Honestly, it used to scare me to go into the hospital. Not for the needles or the doctors or the sickness or anything, but just for the price of it. They don't tell you how much they're going to charge you, and it could be $100 or it could be $1,500, and that's a tough pill to swallow sometimes.
Yeah. But $80 a month is affordable for you.
$80 a month is very affordable, and the amount of care that you get with that $80 is unbelievable.
Have any issues with blood sugar?
That level of care is what draws patients like Diana Christensen. She has health insurance but opted to pay the clinic membership fee. Now expecting her second child, she values the more personalized care here.
Not that we didn't like the healthcare system that we had before. They did great. We had great physicians. We had good care. It's just being such a big system, you fall through the cracks.
It might bring more satisfaction to patient and doctor, but small clinics like these likely add further stress to a system that's already stretched thin.
One of the major problems in healthcare delivery is the shortage of primary care health professionals. The baby boom generation, which makes up a significant portion of physicians, are retiring.
Robert Berenson, himself a retired primary care doctor, is now at the Urban Institute. Besides retirements, he says, fewer medical graduates now opt for primary care. Aside from the daunting insurance paperwork, he says their work is valued far less than that of specialists by insurers, including the largest, Medicare.
The Medicare fee schedule assumes that a dermatologist takes 29 minutes to freeze a wart with liquid nitrogen. A service is not even a procedure that takes about 15 seconds. The payment is as much, or I think a little more, than a physician spending 15 minutes with a patient with multiple chronic conditions.
And he says attempts to raise primary care reimbursement have proven difficult amid rising healthcare costs overall.
When I've discussed this issue with private health insurers and say, why don't you increase the payment to primary care doctors? It'll pay off in the long run. Their basic answer is that we don't focus on the long run. And so the Congress needs to step up in terms of Medicare, but it doesn't. And that goes to the whole issue of election financing and all of those issues, which are above my pay grade.
So the trend is just the opposite of the Birchwood model. Large group practices now employ about 2/3 of all primary care doctors in America. Many are owned by insurers and even private equity investors.
There are a lot of morally injured doctors who are living every day with that conflict of what they believe and how they wanted to deliver care, but they're up against a system where they feel trapped to some degree, you know, and they're having to just kind of play along to exist. We'll figure all that out. The people that I see here, I do an exhaustive dig into their old records. It's shocking and kind of horrifying at how common I find things that have fallen through the cracks. And that's just the nature of doing medicine in 15-minute increments. Okay.
In a system of ever larger healthcare organizations, Doll Winther says she feels fortunate to be able to practice medicine as it traditionally has been in America, in a small, independent clinic. For the PBS NewsHour, I'm Fred DeSam-Lazaro in Birchwood, Wisconsin.
Fred's reporting is a partnership with the Undertold Stories Project at the University of St. Thomas in Minnesota.